As a primary care doctor, I'm happy to hear about anything and everything, and sometimes I joke to my patients, I'll see you every day if you need me to see you every day. I would definitely go to the ER over, you're talking to your PCP's office if you think there's something life-threatening going on.
It's difficult to say each situation that would require an emergency room visit, but we are clear that some conditions such as sudden shortness of breath, sudden chest pain, where we may think someone might be having a heart attack, a pulmonary embolus, things that are serious life-threatening conditions, require 911 emergency room visit immediately.
A parent should take their child to the emergency department if they are having difficulty breathing, if their face is swelling, such as a severe allergic reaction, or they have significant trauma where they're bleeding, they're worried about a limb injury, a head injury. If their child is acting fine, breathing comfortably, there's a rash or a cold, they're worried about an ear infection, call your pediatrician.
So you would go to an urgent care facility versus an ER for a broken bone, a twisted ankle, something that's not a true emergency, but it's urgent. Urgent care facilities have X-ray machines and have usually ER physicians on staff, and they can get you in and out so much faster than waiting in an emergency room.
Urgent care generally is used when primary care is not available. So if we don't have an opening in the office, then we refer our patients to the urgent care, but most of the problems we handle at primary care office.
Having a signature PCP provides an additional access, which is the urgent care that we have at one of our main sites, and having this information from your electronic record from your primary care office in the urgent care, it's a huge plus for our patients, because when you go to the urgent care at Signature, they actually will have your medications, your problem list from your primary care office right there when you're seen in the urgent care. We also have weekend hours, which is a big, big plus.
I think the best way to provide good comprehensive primary care is to provide services that do everything in the office that you cannot do in an emergency setting. And working in an emergency setting for the last 8 years, 80% of what I've seen could be done in an office setting. So I think it's really the direction where healthcare should be, because our ERs are overloaded almost every day with enormous waits, and a lot of it shouldn't be in an emergency setting. It's not an emergency.